A very good morning to you all. I am Dr. Jacob from the Department of Prosthodontics, and today we will be learning about Aramany's classification. Aramany's classification is a classification which describes to us the different maxillary defects. Maxillary defects can be either acquired or congenital. Acquired maxillary defects are usually a result of maxillectomy or surgical removal of the maxilla. The first recorded case of surgical maxillectomy dates back to the year 1841 and was performed by a doctor named Liston on a 21-year-old patient for nasopharyngeal angiofibroma. Various classifications have been proposed to describe these defects and also guide the surgeon for reconstruction and rehabilitation, but no one classification is universally accepted. Now let's look at Aramany's classification for maxillary defects. Aramany presented a classification system for maxillectomy defects in the year 1987. He divided these defects into 6 categories. This was based upon the relationship of the defect with the abutment teeth. Let's look at Aramany's class 1 maxillary defect. This is an Aramany's class 1 maxillary defect. The resection or defect is performed along the midline of the maxilla. Teeth are maintained on one side of the arch. It is the most frequent maxillary defect. This is an example of Aramany's class 2 maxillary defect. The defect is unilateral. It retains the teeth on the contralateral side. This is an example of Aramany's class 3 maxillary defect. The palatal defect occurs in the central portion of the hard palate and may involve the soft palate. The surgery does not involve the remaining teeth. This is an example of Aramany's class 4 maxillary defect. The defect crosses the midline. It involves both sides of the maxilla. There are few teeth remaining which lie in a straight line. This is an example of Aramany's class 5 maxillary defect. The surgical defect is bilateral. It lies posterior to the remaining abutment teeth. This is an example of Aramany's class 6 maxillary defect. This defect occurs mostly due to trauma. The defect lies anterior to bilateral standing abutment teeth. Surgical intervention of anterior mid-palatal pathology can also cause such type of defects. This is an excellent classification and is devised in order to guide the prosthodontist in designing an obturator. It is, however, deficient in description of the surgical defect and does not provide information about the resection of the orbital contents, facial skin, or soft palate. Having seen the most popular classification, that is Aramany's classification, we will now look at a few other classification systems for maxillary defects. There are 3 other classifications for acquired maxillary defects, the first being Spiro's classification. Spiro has divided maxillary defects into 3 classes: class 1 limited, class 2 subtotal, and class 3 total maxillectomy. A second classification is Cordero's classification. Cordero classified acquired maxillary defects into 4 classes. Class 1 limited maxillectomy, where 1 or 2 walls of the maxilla are removed but the palate is preserved. Class 2 or subtotal maxillectomy is where 5 out of 6 walls of the maxilla are removed with preservation of the orbital floor. Class 3 is called total maxillectomy where all 6 walls of the maxilla are removed. This may or may not involve orbital exenteration. And class 4 is orbitomaxillectomy where 5 out of 6 walls of the maxilla are removed with orbital exenteration but preservation of the palate.